Medicare's annual enrollment period starts tomorrow, October 15th. And if you have Medicare, this is time of year to review your coverage and decide if you want to stay with your current plan or enroll in a different one. You may review your benefits and the cost, but have you ever considered the quality of your health plan? Well, today we have Karl from People's Health to explain the importance of Medicare Star Ratings. Good morning, Nick. How are you?
I'm doing great, Tommy. Thanks for having me.
Looking forward to that cool weather, I'll bet you, huh?
No doubt. Looking forward to the start of the Medicare season and as well as the cool weather.
So tell me, what are Medicare Star Ratings?
So each year, kind of the Centers for Medicare and Medicaid Services, CMS as we call it, really measures how well Medicare Advantage and Part D prescription drug plans perform. And really they rate these plans based on a scale of 1 to 5, with 5 being the highest score that a plan can receive. And each October, just before the annual enrollment season starts, they post them for that calendar year so that beneficiaries know kind of the quality and performance of the plan that they're joining.
So what kind of factors go into a star rating?
Yeah, I mean, there's many factors, and really depending on the type of plan, that's what matters. So as far as for a Medicare Advantage plan that includes prescription drug coverage, there's 44 unique quality and performance measures that they judge you on. If you're in an MA-only plan, which means a Medicare plan that does not include prescription drug coverage, you have 32 measures that you're rated on. And then for a prescription drug plan or a standalone drug plan, those are rated on 14 measures. And really, the Medicare takes into consideration many things: preventative care, kind of meaning how well the plan member has access to healthy and annual wellness visits, vaccinations, preventative screenings, how well we manage their chronic care and keep the members healthy with, over time, really our customer service and call center services, as well as our plan processes for appeals and new enrollments. There's a number of factors, complaints, Part D coverage, the overall member experience and how satisfied members are with the plan. It all goes into it, and it's based on the data that CMS collects and member records and claims and those types of things. And really, they grade you on your overall experience on how you treat your members.
It seems pretty complicated, but I guess those star ratings are pretty important.
Yeah, they're super important, really. And Medicare created it to provide consumers with an easy, kind of unbiased way to compare plans. And when most people go out and shop for Medicare plans, they look at the benefits and the costs, right? And that's a huge factor. But when comparing plans that are similar in cost and coverage, the star rating really comes into play. And it's great to have low-cost benefits, but if you can't access them or the plan's not going to deliver them in a quality way, then there's not much to that. So this is a huge, huge way for people to compare and see in an unbiased way how their plan rates up and stacks up against their competitors. So Medicare reviews this yearly, and again, they release their new star ratings each fall, and that means that the plan ratings change year to year. And for a low star plan, meaning that for 3 years in a row that Medicare, you get a 2.5 star rating, then the Medicare plan could go away or is at risk of being closed. And then again, this has been going on since 2008, and People's Health has always scored really high. For the last 4 years, we've earned a 4.5 star out of 5 star rating. We're the only Medicare Advantage organization in Louisiana to achieve the highest rating for the last 4 years consecutively. So it's something we take very serious and something that really consumers should take a look at and compare plans.
I know when I look at a review of anything and I see 4.5 stars, I pretty well count that as 5. But are there any 5-star plans?
Yeah, so 5 stars is really difficult to achieve. And last year there were only 21 out of 400 plans nationally that were rated 5 stars. So really only 5% of the overall plans. But really we're super excited. Being 4.5 stars for the last 4 years, we were teetering right on that 5-star, the ability to say we're a 5-star plan. And this year we're super excited to announce that we are rated 5 out of 5 stars by Medicare. So it's a great achievement, something that we've been working really hard towards, and we finally climbed that hill.
That is outstanding, because that is not easy to do, and you guys got to be pretty proud about that. And I would imagine the people that are members of People Health are pretty happy about it as well.
Yeah, so we just announced it last week, and there's a lot of excitement around it. In Louisiana, there's never been a 5-star plan, and we're excited to be a first.
That's a hell of an accomplishment. In the top 5%, we're going to take a quick break. We come back, we'll talk about when can you switch Medicare plans, where can people find information on a plan stars rating, and, of course, Newell's going to be out at the brand-new facility today. We'll talk about that as well with Nick Karl with People's Health. Tomorrow, open enrollment begins for Medicare. So we'll give you all the information you need on that coming up on 8:20. Let's look at traffic on WWL. 8:24, Tommy Tucker, Thursday, October 14th, day 46 of the IDA recovery. Thank you for getting your day started with us. Medicare's annual enrollment period starts tomorrow, October 15th. If you have Medicare, this is the time of year to review your coverage and decide if you want to stay with your current plan or enroll in a different one. Nick Karl is here with People's Health to help us kind of understand what's going on, or help you understand what's going on if that applies to you and you're Medicare eligible. Nick, when can you switch Medicare plans?
Yeah, so for most people, they can switch during the annual enrollment period, which, again, like you just mentioned, starts tomorrow, October 15th, and runs through December the 7th. So during that period, they can make a change to how they receive it. They can join a different plan. I mean, there's a number of ways that they can change plans. But there's also exceptions that allow you to enroll outside of that period. For example, if you're new to Medicare, you have a 7-month window when you first become eligible for Medicare, usually around your 65th birthday. You usually can join 3 months before, the month of, and 3 months after your birthday. Mm-hmm. Or if you have Medicaid, or if you move into a new service area, you could qualify for a special enrollment period, which would allow you to join right away. And you can also qualify for a special enrollment period if you want to enroll or switch to a 5-star plan. So that's one of the benefits of being a 5-star plan, is it means that people can enroll into your plan once a year outside of the Medicare annual enrollment period.
That is huge, is it not?
It is. It's a great opportunity for folks that are in a plan that is not 5 stars to join one at any time. But again, it's once per year that they can change into a 5-star plan. So we're not locked into just October 15th to December 7th. They can change any time in that calendar year.
And keep in mind, only 5% get that 5-star rating, and People's Health did get it. Where can people find information on that plan star rating?
So you can compare plans really side by side and their star ratings at Medicare.gov. There's a great kind of plan compare website that you can go on and compare plans in your zip code. You can also call 1-800-MEDICARE. And when you look at the side-by-side comparison, you'll see a star icon next to the plan if they are 5 stars, and proud to have that 5-star icon next to our People's Health plans in 2022. And then you'll also see an alert on the icon if it's a low-performing plan, like I mentioned. So if they're 2.5 stars or lower, you'll see an icon for that as well. So they call out the top and they call out the bottom, but there's other plans in the middle.
How can people learn more about People's Health 5-star plan? And you got to say that, because I think that should be part of the name of it, People's Health 5-star plan.
I think you're going to hear a lot of that, Tommy, and we're really, really excited about that. I mean, it's a really, really big accomplishment for us. But we're going to be hosting a mix of virtual and in-person benefits presentations really from now through December. So the in-person events will be hosted in a safe environment, socially distanced. We'll offer one-on-one meetings where you can review your specific needs with a licensed plan representative. We do want reservations for those, so you must call in and reserve a space for that so that we can keep it safe. And you can review those dates at peopleshealth.com/meetings, or you can give us a call and find the event nearest you at 1-844-600-7910. And like you mentioned earlier, today we're also doing the grand opening of our new People's Health United Healthcare Medicare Center, which is at the intersection of Veterans and North Causeway Boulevard in Metairie. It's next to Party City. And this location is going to be a great spot to meet in person with one of our representatives, and you can learn about your Medicare options. You can discuss questions you have. Well, walk-ins are welcome there, but you can also call and reserve and make an appointment. So This is for prospective members of People's Health. They can come in, and we'll help them in any way that we can.
And Newell Norman's going to be there as well, broadcasting live from 10 until 1. So you can go out, and if you've admired the sheriff and always wanted to say hello to him, he's a very approachable man, and he'd love to meet you. Nick, Karl, how can people find out more about People's Health?
Yeah, the best and easiest place to find out is visiting peopleshealth.com. It's got everything you need to know about People's Health on the website. If you want to learn more about the star ratings, we have a specific site for that with peopleshealth.com/5-star, where you can learn about our new 5-star rating, or you can call us at 1-866-687-7335, and we're all over social media. You can follow us on Facebook, Twitter, and on Instagram.
Nick, congratulations on that 5-star rating. That, again, is some pretty rarefied air, and y'all should be very proud of that.
Thank you, Tommy. We are.
You bet. And we'll talk to you again soon, all right?
Sounds good.
You got it. Open enrollment begins tomorrow for Medicare, and Newell Norman's going to be out today at the new facility. And I would think it'd be a lot easier to sit down and talk with somebody. Appointments, as Nick said, are encouraged, but you don't have to have one, especially if you want to go out today while Newell's there from 10 until 1. People's Health, a 5-star rating, and those are not easily attainable. We'll take a quick break. When we come back, we're going to talk to David Hammer, WWL TV investigative reporter,